Hello, my name is Yulianah. Today I'm going to present you my research poster. But before I start, I would like to ask you, what are you going to do if you have stroke attack? Will you go to the hospital as soon as possible, wait until your condition become better, or you will go to traditional treatment? In your opinion, based on those options, which one the best action to do? Ministry of Health, Republic Indonesia 2019, said that the best time to handle a stroke is known as the golden period, which is less than 4.5 hours from the occurrence of symptom. Haryanti Harsono and Prabandari 2015 in their research show that 18.7% of patients come within 3 hours after symptoms occur and 81.3% of them arrive at hospital more than 24 hours after stroke symptoms occur. Based on this phenomenon, we have to prevent from pre-hospital delay because delay in pre-hospital stroke action can increase mortality and morbidity of stroke. One of the causes of delay in pre-hospital stroke is the lack of stroke awareness. That is the basis for taking appropriate action in the event of stroke to reduce the incidence of morbidity and mortality. So, the research objective of this study and to identify the relationship between awareness among the patient at high risk for stroke and pre-hospital stroke action. Method stroke awareness was measured by the knowledge, attitude, and practice of stroke symptom by TAPA 2016. Meanwhile, pre-hospital stroke action was measured by the stroke action test instrument by V-BINC 2005. The study used a cross-sectional design and purposive sampling technique involved to 144 respondents. The results show that the most respondents were in the range of 36 until 40 years old. 56.3% were female, 53.5% had tertiary education, 42.4% were Japanese, 43.8% had a monthly income of more than 3 million rupees. 45.8% knew someone who had stroke, 87.5% were non-smokers, and 38.2% were hypertensive patient. As you can see on diagram, for detail, hypertension is a 38% respondent, diabetes mellitus 12%, atrial fibrillation 3%, hyperlipidemia 19%, and the respondent who had more than one risk factor of stroke is 28%. And the result of awareness and pre-hospital stroke action show that more than half of the respondents, or 52.1%, have low awareness, and half of the respondents, or 50.7%, had non-corresponding pre-hospital stroke action. As you can see on the diagram, low stroke awareness is 48%, and high stroke awareness is 48%, and low stroke awareness is 52%. For pre-hospital stroke action, the corresponding pre-hospital stroke action is 49%, and non-corresponding pre-hospital stroke action is for 51%. Then the result of awareness domains among patients at high risk for stroke in Jabodetabek in July 2020 show that the low stroke knowledge more than high stroke knowledge, and low knowledge of sign and symptom more than high knowledge of symptom and sign. And 100 or all of the respondents have low knowledge of risk factor. And the last is attitude of prevention and control risk factor. Low attitude of prevention and control risk factor more than high attitude of prevention and control risk factor. As you can see on table 1, table 1 shows that there was a significant relationship between awareness among patients at high risk for stroke and pre-hospital stroke action, with p-value is 0.000, with alpha value is 0.05. And the discussion of this study, patient at high risk for stroke, according to Ministry of Health Kemenkes 2019, as many as 90% of stroke cases are related to 10 main risk factors, including hypertension, diabetes mellitus, heart disease, atrial fibrillation, hypercholesterolemia, obesity, and severe risky lifestyles such as inactivity, unbalanced diet, smoking, and drinking alcohol. Based on the research, it was found that the respondents who had the highest risk of stroke were hypertension patients. These are following the risk assessment data in 2018, which states that hypertension is one of the common diseases in society, with a prevalence of 34.1%. Riskesdas 2018. Awareness among patients at high risk for stroke is formed from 4 main domains, namely knowledge of stroke, knowledge of sign and symptom of stroke, knowledge of stroke risk factor and attitude to prevention, and control of stroke risk factor. Based on the result, it showed that low awareness occurs in more than half of the respondents. Half of the respondents thought that traditional medicine was effective in treating stroke. The traditional medicine system is one of the socio-cultural poles. Those are in line with what Haggis expressed. Pre-hospital stroke action in this study showed that more than half of the respondents had the non-corresponding pre-hospital stroke action. When compared to previous studies by Billing, Gagliardi, and Mazur, which showed that only a third of respondents had or less than half respondent had their corresponding pre-hospital stroke action. Thus, this study had better pre-hospital action outcomes than previous researchers. This could be due to a difference in the respondents' clinical condition. In previous researchers, respondents were a group of ordinary people whose health status was 49.6% excellent, 35% good, and 15.4% quite good or bad. In contrast to this study, which is a patient at high risk for stroke had improving pre-hospital stroke action if stroke attack happened. For conclusion, the result of this study indicate that awareness of stroke is a suitable factor for pre-hospital stroke action. This study recommends health workers, especially medical, surgical nurse, and the community to provide health education intervention in the form of knowledge about stroke and its symptoms, stroke risk factor, and promoting attitude to prevent and control stroke risk factor to increase awareness as a basis for taking action in the event of stroke. Further research can continue research on other stroke risk factor and two different respondents, namely families who have family members at high risk of stroke. Acknowledgement. Thank you for the Director of Research and Development who has provide funding for the University of Indonesia International Index publication or PUTI in 2020, and all respondents who have participated are research correspondents. That's all from me. Thank you.